you very much for having me here. My name is Dr. Nikita. I'm working in Singapore.
Such a fantastic course, and I'm so glad I attended it. I think the most impressionable part was all the hands-on procedures that we got to do, and to learn from like very experienced radiologists how to do certain procedures and little tips and tricks to help make our treatment a little bit better for our patients as well. I think they've done a really good job getting our international faculty here of all very experienced surgeons as well as radiologists. And I think it's such a great event to like network and learn more about each other's practices in each countries and the differences and limitations of each country as well.
I really love this course. It is actually beyond my expectation.
Well, I think they really got together a lot of the experts from different countries, so they were able to share their unique experiences from their own perspectives, since different countries have different challenges in terms of the practice for breast surgery. So I think they really did a very good job in bringing all these people together to give very valuable and helpful insights.
One of the most important parts of managing breast patients is multidisciplinary collaboration, and having breast surgeons, radiologists in the same room and in the same space sharing their perspectives has been very valuable to me.
I think the workshops were really very good because the facilitators were really very passionate about teaching the attendees.
Preparations and material and knowledge is shared before as a preparatory material. After the program is over, there is a continued support available to you to answer your queries, to clear your doubts, and to hold your hand in your practice to start applying this knowledge that you have learned here. So it's a wholesome experience, and I think there's nothing short than coming and taking this experience on your own. So do come and join us for our future events to take this first-hand experience.
So I feel that this course is good because it offers a platform for surgeons, radiologists, and even pathologists to interact with each other, understanding what it takes for different specialty to work together. And this is very similar to a multidisciplinary team work that we are used to in hospital setting.
Hi, I'm Dr. Patrick Sunga. I'm a fellow in training in the Philippines, fellow in training in surgical oncology. Hands-on experience on the instruments or new technologies BIEDX has provided.
Hi, I'm Dr. Sabrina Ngasurin. I'm a breast surgeon specializing in oncoplastic surgery and minimally invasive breast surgery, and I come from Singapore. BIEDX has put together a very comprehensive program that allows a whole spectrum of proceduralists, whether you're a surgeon, radiologist, of all backgrounds and all different types of phases in your training, in order to empower all of us to be confident to perform procedures.
I think this is a wonderful platform. It is very seldom that we have an opportunity for radiologists and surgeons to be seated together. And what more, this is a global setting where we have met so many different participants from different countries, and the experts are all renowned experts in their own countries. I think I benefited greatly from the hands-on opportunities. There are multiple different stations available, such as core biopsies, as well as wire placements. And at each station, there have been ample opportunities to practice, and the experts have also given many valuable tips which I'm going to bring back to my practice.
Attending this kind of event is very important, especially if you want to advance your weapon as a surgeon, or even though if you've been doing lots of cases, there's still new ways on how to do it. There's still other new ways on doing things. Definitely learn in this kind of event.
Oh, I think please attend. You can gain so much, and then after that, the networking is also very good. So I think if you have an opportunity to attend this session, you should go for it.
I'll give it a 10.
I'll just rate it 10 out of 10.
Definitely 10. I like this. I like this course. It's very informative.
And use it in their clinical practice to improve the breast care, and definitely I can see the change, and it's definitely for good. So I'm very happy about it, and thank you so much for having me here.